My name's Jason Capra. I live here in Pensacola, Florida. And right now I'm Chief of Endoscopic Spine Surgery at Neuromicrospine practice. And I've been doing endoscopic spine surgery for about 8 years now. And I've done thousands of procedures, but the more we do, the more skills we have, the more different parts of the spine we want to work on, and we want to start challenging ourselves to broaden our experience. So I knew there was an area of the spine, the cervical spine specifically, that I had never done this specific procedure. I knew that I had the skills to do it, but I did not have the confidence at all. And so when you're trying to choose people to learn from, there are very few that have a large amount of knowledge, experience, and a good reputation, and have been trained by the founders in the field. And Dr. Mork is one of those people. So you can go to workshops, you can learn from a lot of different people, but I don't want to just learn from anyone. I want to learn from the best because I want to be the best. And if I'm putting my hands on someone, then they deserve the best. And that's why I chose to learn from Dr. Mork, and that's why Dr. Mork and I remain close personal friends and associates, because I'm not going to put my patients at risk by not having adequate knowledge and learning from someone who's not an expert. My favorite part about the course is that it's very structured, and this is how all of the products that he puts out are. He's a very good teacher, and when you watch the course, you know at each step, at each module, what you're going to be learning and what you have learned. And it's arranged in a way where you can then go ahead and review those modules. I also like it because it's extremely comprehensive. You're not just learning anatomy. You're not just learning how to do the procedure. You're not just learning the equipment. You're not just learning billing. You're not just learning, you're learning all of those things together in one package. And I honestly haven't seen that anywhere else. And I especially think that the way that he actually shows not just the procedure. We have other people, you can watch YouTube videos, you can see someone putting a scope and they'll film the procedure from inside the camera. But he actually takes a step back, shows you the operating room, shows you the positioning of the patient, shows you how to position the arms, the back, the leg, shows you what cushion he uses. It's so helpful to see that outside view, because that's going to be you in the operating room. You're going to be responsible for all those things. And once you get the scope in, then the fun starts. But he teaches you everything leading up to that part, and then how to actually do the procedure as well. So I really appreciate that part of it. And so when I showed up the next day at the surgery center, I knew everything to have it laid out, and I did it exactly according to the video. And it's not that it wasn't anxiety provoking, but I knew that I was prepared, and the case went great. And I actually called Dr. Mork that day, and I made sure I thanked him personally, saying, if it wasn't for you doing this, this patient would not have had this care, because I would not have been confident enough to do this just on my own. I would definitely recommend this course to anyone that is trying to either get into endoscopic spine surgery and doesn't know where to start, or already is in endoscopic spine surgery but wants to branch out and do more complex things. The reason why is that it's not just about going to a cadaver course and learning the procedure. You have to know all of these other unmentioned variables that you don't even know where to look for the answers. And you're looking in some places for anatomy, you're looking at some places for billing, you're looking in other places for equipment. It's laid out all in one place. And the peace of mind that you can get from saying, I know where to go, I'm gonna study the material. The night before the surgery, I'm gonna go back over the video, I'm gonna study it again, and when I come into the surgery, I'm gonna be confident and I'm gonna know exactly what to do. I honestly do not know anywhere for endoscopic spine surgery that kind of product exists. And this is not only one of the only products, but without a doubt, even if there are other products, they don't match the quality of this one.